This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank. We have had Peter Marinoff as our guest many times here on the show, and he's always got a lot of great information to offer. Peter is the community president of Munson Healthcare Cadillac Hospital. And good morning, Peter. How are you?
I'm doing well. How are you doing?
Doing great. There are things going on at Munson Healthcare Cadillac Hospital that we want to talk about. So we're going to jump right into this, Peter. Let's talk about the Da Vinci robot, what it means, what it is, and what it means for your professional staff, and more importantly, your patients in Cadillac.
Yes, it's the Da Vinci system. It's robotic surgery, and so we've looked at the platform many times before, and just for whatever reasons, we weren't ready to bring robotic surgery to Cadillac. Well, meeting with our physician team, we're ready now, and so for the Cadillac community, it's going to mean that we're going to be able to expand some of our offerings here because of robotic assisted surgery. So I think a lot of the expansion we'll see within gynecology. So Dr. Tremp and Dr. Curran, they're going to be able to keep more in the community and do more surgeries. So women won't have to travel out of the community. For general surgery, it will be, I kind of look at it as a little bit of keeping up with what general surgeons are trained on now. And so if you look at our existing general surgeons in Cadillac, really they're able to do surgery, and they do really great laparoscopically. But a lot of surgeons that are coming out of school are trained robotically. So as we look to expand here in the community, we need to really kind of offer that robotic option. So it will allow us to do some more procedures here with general surgery, but it's also going to help us to continue recruiting to the community.
That was going to be my first question is does that make it an easier recruiting tool for you?
It does. And really, it just, if you're training on something, if that's what you're learning on, then that's what you're going to want to use to do surgery. So, the robotic system, it really offers, it's minimally invasive. So you have your quicker recovery times, less scarring. There's a lot of advantages with it. Surgeons can have, what we would call 3D visualization. So they get, this magnified view of what they're doing surgically, and just kind of more range of motion. So really, some operations can be pretty tough, and this will allow them to really do a lot more surgeries that they may have been hesitant to do here originally. For us, we're going to be doing a series of educational events. So having various community members come in to see the robot in action, but also to have physicians come in and see the robot in action as well. So it's really, some surgeons will be using the robot, but we can kind of share with our whole medical community what they can expect, and just kind of understanding what the robot can bring to our community.
And this is for general surgeries, urology, and gynecological surgeries. Is this correct?
That is correct.
Okay.
And then for urology, we'll be able to start offering prostatectomies in the community. So that's something we've not offered for a long time. So it's something I would say we'll probably start offering in the spring. So we'll work through our urology office here in Cadillac, working with Dr. Drabick and Dr. Glaze, and then kind of having some assistance from a visiting urologist to help out.
So what would you say to someone who is leery and they hear the word robot in association with surgery and they go, "Oh, that scares me"? What would you say to calm the nerves of folks?
It's a technology that's been there for a very long time, and it's a proven technology. So the robot we're getting is the latest technology. the training and education for our providers is pretty extensive. For the staff that would work in tandem with the surgeon, pretty extensive. So the recovery rates are great. I actually don't have it in front of me. I can't believe I don't have it in front of me. But it's much improved for recovery rates. The infection rates much lower. And I think just the overall experience with it is just a better experience for the patient. And that's something that's been proven. This isn't like a 5-year thing. This is probably 20 years or so, maybe even right around there.
Okay. Let's talk a little bit about Munson Healthcare recently being designated as a comprehensive stroke center. What did it take for Munson to achieve that designation?
You know, I want to call out that team at Munson Medical Center for getting that designation. I won't go into all of the detail of it, but I will say to get the designation and to be associated with a tertiary hospital like that, it's just an honor, and we're really proud to be associated with them. I think what's important to know is 2% of the hospitals in the nation get that designation. So it's 2%. So if you think like there's 5,000 hospitals, not a lot have the designation. It's going to really, it demonstrates, I think, to everybody that, you know, having that care close to home and having what we would call a program set up to minimize that time from when you present to one of the ERs or present to the hospital to when you're getting treatment. It is a very fast process. And that's important because when we're talking about stroke, time is what matters the most, right?
Is everything, yes.
It is. And then, you know, it kind of has been, this has been a journey really over the last few years. And so it's been a lot of investment by the system to really grow the program, not just in getting, you know, some of the best people in the country into the program, but also making the capital investments to make it right. And then working with the outlying hospitals to kind of create not just a place in Traverse City, but really building a network for care, stroke care in Northern Michigan. It's pretty awesome.
Let's talk a little bit about virtual urgent care. Now, Peter, this time of year is the time when you could look out your window and not want to leave your house. So, in fact, that's actually it's happened just in the past week, and given the forecast, you know, it's happening again this weekend. But tell us a little bit about the virtual care options in the Munson healthcare system.
So I have to tell you, I actually use this, and I can talk about it because I'm violating my own HIPAA. So
as long as it's yours, okay. It doesn't matter, right?
Yeah. And so I showed up to work, this is a few weeks ago, and tested myself for COVID a few times to make sure I didn't have COVID, but I just had a sinus infection, and I connected with the virtual urgent care on my phone in my office, and so you kind of reach out, you set up your appointment. I got a ping back, text back that said, "Let's get you registered." I took a picture of my insurance card, shipped that in, and then connected with a physician. It was not more than 5 minutes that I spent in that. And it was amazing.
It only took you 5 minutes to prepare for it?
5 minutes was my total visit.
Wow.
And
it takes you that long to scrape the windshield, Peter.
It takes me that long to find my stuff in the office, to walk out of it.
Right.
So, it really is kind of a nice option to have for, if you kind of know what's going on, the annual sinus infection, with COVID or different things, sure, you want to be cautious with it. But, if pink eye, sinus infections, skin rashes, there are things that you can do and work through these urgent cares virtually and really not have to upend your life to go to an urgent care or to get into an ER, the doctor's office, so it is kind of a nice option to have, and it doesn't replace primary care. It doesn't replace, a real urgent care, or it doesn't replace the ER, but it's great to have another option. And getting to experience it 5 minutes, I was really happy. So it was nice to have.
In the few minutes that we have left, Peter, let's talk about January being Cervical Cancer Awareness Month and how important screenings and early detections are.
And I appreciate you talking about that and bringing it up, because it is really important to do your screenings. I know that it's not like everybody loves to come in and get a colonoscopy. But
raising my hand right now, I had one last year, the first one I ever had. I lived through it. Not exactly the most pleasant experience, though.
Yeah, it's not. The prep is not fun, but it's great to screen and to see if there's anything that may be that just may not be right, or that maybe you should kind of get a little more, I would say, get a better look at. But, January is Cervical Health Awareness Month. And so, it's important to get in and to just visit with your OBGYN. So if you don't have one, we do have Dr. Curran, Dr. Frankowiak, and Dr. Tremp here. And they can kind of help to get you in the office for screening. So, pap smears, HPV testing, that's important. Lifestyle choices, important. They can kind of walk through those things. But I would say regular checkups are key. And, we have these months called out to just highlight a point for people to say, boy, don't forget. It's like we have Heart Health Month, breast screening months, and cervical health month is important too.
So let's talk a little bit about where people can interact online with Munson Healthcare, Cadillac Hospital, and in the system at large to stay up to date with all these things.
I think part of me being on here is to kind of help everybody stay in tune with it. I'll be honest, our website sometimes does not cover all of the things going on. So we work with you, we work with other local media, the Cadillac News, 9 and 10, to try to keep this in front of everybody. But we do have the Munson Healthcare website, and so you can find a lot of these things on there. But I think for things such as Cervical Health Awareness Month, you can find those on a lot of healthcare websites, because we do. It's a national thing that we want to call out, because really early screening is the difference in kind of saving lives. So you can be active in kind of your own health by doing early screening.
Peter Marinoff, Community President of Munson Healthcare Cadillac Hospital, has been our guest on this morning's edition of Cadillac Unscripted. Peter, once again, we thank you for your time, and we look forward to chatting with you again soon.
Thanks so much.
Join me and Katie next week, same time, same station, for some more local chat. Cadillac Unscripted, sponsored by Independent Bank on 107.9 CDY.